Have you heard of valley fever? It's a fungal infection found in the desert of southern Southwest U.S. Thousands of people get it each year, and it can look like pneumonia, TB, or even cancer. Today, I'll explain what valley fever is and how it presents, how doctors diagnose it, and what the blood tests mean. What is valley fever? Valley fever is caused by Coccidioides fungi found in dry desert soils of California, Arizona, Texas, and New Mexico and Mexico. Infection happens when fungal spores are inhaled during dust storm, farming, construction work, gardening, etc. It's not a spread person to person. So how do they present the patient? They usually have pulmonary symptoms, lung-related fever, cough, chest pain, fatigue, night sweats. Sometimes they have a skin rash and skin bump called erythema nodosum. It's painful red bumps. Sometimes it could be severe in kind, called severe disseminated disease, which can affect the skin, bone, joints, even brain, causing meningitis. It's higher in pregnant women, immunocompromised people, elderly, and certain ethnic groups. Prevention: avoid dust exposure in endemic areas. Very important. Wet soil before digging. Wear N95 mask if you're working outdoors. And there's no vaccine available for this. Diagnosis: chest X-ray may show nodules and cavities, but very non-specific. Culture and histology. Now, it's a gold standard to find spherules with endospores, but usually we do the serum test, but dangerous to lab staff in general, but they take precaution because they have to follow certain protocols. But serology is the most commonly used for diagnosis. It detects IgGM and IgG antibodies. Antigen test and PCR are helpful in severe or disseminated cases. So treatment: many mild cases resolve, most of it resolve without treatment. Antifungal treatment is available for moderate to severe cases. Fluconazole, we also call diflucan, or itraconazole, they are preferred treatment. Amphotericin B, we keep that for disseminated disease. In case of meningitis, CNS infection, long-term, lifelong use of fluconazole is recommended. So let's talk more about serologic markers, because that's where confusion arises many times for patient. So IgM, normally that reflects the recent infection, and it's called tube precipitin test. It appears within 1 to 4 weeks, and it means recent or acute infection, and it declines after weeks to months. And then this is the main test, which is called IgG complement fixation test, CF. So complement fixation test appears later and it persists longer. High titer indicate active or disseminated disease. A rising titer means it's worsening. Falling titer means it's recovering. So what is CF titer significance? If less than 1:2, no significant disease. If it is in between 1:2 to 1:16, that means it's active pulmonary infection. If it is more than 1:32, it's likely disseminated. So valley fever can look like many other illnesses, but knowing the risk factors, spending time with the patient and knowing about their lifestyle and their work, knowing the risk factor, blood test, and treatment all makes the difference. So if you live in a desert area, travel to a desert area, you work outdoor or in gardens, be aware of it. Stay safe. Don't forget to subscribe. And for more medical insight, thank you for watching, and thank you for sharing, and thank you for asking questions, making comments. I really appreciate each and every one of you. Have a great Monday.